Namaskar to all. I am Dr. Anubha Jain, Senior Journalist with ETV Bharat. And today I will speak with Padma Shri awardee and distinguished oncologist Dr. Palkonda Vijay Anand Reddy. With over 3 decades of experience in oncology, Dr. Reddy has made contributions to cancer treatment and patient care in India. He currently serves as the Director and Senior Consultant Oncologist at Cancer Hospital, Hyderabad. His expertise spans radiation therapy and medical oncology, ocular cancer, retinoblastoma, especially in children. Dr. Reddy has played a pivotal role in advancing cancer care and improving treatment accessibility. Welcome, Dr. Reddy. It's a pleasure to have you with us.
Thank you. Good evening. Good afternoon.
So, sir, first, we like to know over the last 3 decades, what changes in cancer care have surprised you the most?
Yeah, so in the recent past is about the artificial intelligence and the computer technology that has tremendously improved, and there's a lot of changes in the management of malignancies and the medical genomics. So the genetic analysis and tumor targets that we are able to identify. What are the problems that are in a normal cell converting into malignancy, and what are the targets that can be targeted? So we have so many targets that are identified within the tumor cell, and we are able to treat precisely. It's no more a general cancer treatment. It is highly precise and individualized based cancer treatment. So each tumor also has multiple targets, and each site has got different targets. So based on each target that we are able to more precisely, more individualized treatment. It's called precision treatment. So that's available. Besides that, earlier days when you have an organ involved in a cancer, we used to take out the organs completely. Now we are able to preserve the organ. We are able to give them normal functions. So our preservation of organ as well as function without compromising on the cure. So that's been a tremendous difference between the past and the present. So, person can get treatment done and then go back to the society in a normal way, continue to do his normal activities.
Okay, right, sir. Sir, ocular cancers are relatively rare and often ignored. So, how are eye cancers different from other cancers in terms of diagnosis and treatment challenges?
As you rightly said, most of the people do not even understand, do not even know, and do not actually they get surprised when we say that cancer, I also can develop cancer. Eye is an organ which multiple organs within the orbit. So eye has got tear producing gland called lacrimal gland. Eyelids have got tear secreting sebaceous glands. These are the external structures. You can develop cancer of the lid, cancer of the lacrimal gland, lacrimal duct. Besides that, eye globe itself can develop tumors like retinoblastoma, which is the tumor of the retina, which actually gives you the image when you see something, whatever you are visualizing, get a screen behind your globe. So that screen also can develop cancer, and that cancer is called retinoblastoma. So these tumors normally occur below the age of 4 years, and it's quite common because we are a tertiary care center for eye cancers in the country. So I see a lot of eye cancers in my career, and we are specialized center to treat eye cancers. So retinoblastoma is one of the common cancers. Out of 10 eye tumors, what we see, 6 or 7 are retinoblastomas. And these tumors are highly curable and should be detected and treated early. And we have got sophisticated treatments, high precise treatment these days available. For example, we do chemotherapy directly into the eyes. So that kind of a treatment technology has come, and we are able to treat more than 1,500 cases that we have treated by doing intra-arterial chemotherapy. So besides that, giving radiation to the eye is also an art. It needs a lot of experience and expertise to treat eye tumors where we can deliver high dose of radiation without causing any damage to the vision. So ultimately what you need to is protect the vision. And behind the eye, you have a brain. So protecting the eye, giving him proper vision, normal vision, and delivering high dose of radiation. That's again because of the new technology, the computer technology, that we are able to treat such kind of tumors very precisely without hurting and without causing damage to the vision and the life.
Right, sir. Sir, since young children cannot clearly describe vision problem, so how can parents detect early symptoms? And is a white reflex in photographs a warning sign?
Yes, so there are different symptoms, and the easiest way to identify these retinoblastomas, which usually come in less than 4 years, and as you rightly said, child cannot complain. But normally, invariably, every child will have a birthday party celebration. So when you normally click a photograph, you see normally is in the center of the eye you have a round hole which is looks absolutely black. So in that area, if you take a photograph, just a normal photograph, you can easily visualize that there is something white colored flower within the center of the eye. So that itself is a radiological and clinical and photographic diagnosis of retinoblastoma. So besides that, the child has can have a squint, can have redness of the eye, can have protrusion of the eyeball. So these are the other symptoms that you can detect retinoblastoma. So earlier you detect, easier the way that you can treat and cure the disease. So we are able to protect the eye vision as well as the globe and save the life as well.
Right. So, sir, how important are routine eye checkups in this regard?
See, normally a early child goes for a vaccination and definitely goes to a pediatrician, child specialist. They would normally look at the child and they would diagnose these retinoblastomas. So it's easier for them to diagnose, and we constantly create an awareness to the pediatricians as well as to the parents and to the society that these tumors are known to happen. Although this happens rarely, but it is quite common in a tertiary care center. We see quite a lot of these tumors. And why we are sensitizing the society and public? Because these tumors are highly curable and treatable. If you delay it, then the patient would lose vision, and unfortunately, in some children, we lose them their lives as well.
Okay. So, sir, to what extent has the ongoing research and treatment on retinoblastoma progressed?
So genetically, these patients would have genetic abnormalities, RB1 gene, and we tell them not to have consanguineous marriages. And in spite of that, child would develop automatically without having consanguineous marriages. Also, they can develop the retinoblastoma. So what we normally we can, well, suppose if you have a child of born to a parent, then we would counsel them. We do genetic analysis and we check what are the possibilities of this parent getting a second child with retinoblastoma. So we counsel them early and we do the genetic analysis. We do amniotic fluid testing and check whether this child, the next born child, will develop retinoblastoma or not. So these are the new things that we are able to do these days and identify them. But unfortunately, we don't have a genetic treatment or gene therapy if the patient already has a abnormal gene, which is RB1 gene. So as of now, we do not have the genetic modifying that abnormal gene. We don't have, but we have certain new gadgets to treat these tumors curbed with local therapy. We call it cryotherapy or transpupillary thermotherapy. We just burn them off when they are in group A and group B, which is very early tumors. So these are highly treatable and curable diseases.
Okay. So, if I talk about radiation therapy, so for a lay person, how would you explain how radiation therapy works and what are the most significant advancements in radiation therapy in recent years?
So radiation is an X-ray in high energy X-rays. When you do the treatment and it enters the body and it hits the water molecule, which is 96% of our body constitute water molecule. So that causes hydrogen ion. It breaks the molecule into hydrogen ion. That in turn hits the a DNA. So when you hit a DNA directly or indirectly, then the DNA damage happens. So the normal cell radiation, when it enters, it hits the normal cell as well as the cancer cell. So what normally happens is the normal cell has the ability to recover. So it's called a DNA damage repair can happen. Whereas a cancer cell also may recover, but it takes time for it to recover. So before it recovers, we do a second hit. That's called radiation done within 24 hours. So that's the reason why we do fractionated radiation today and tomorrow before the DNA damage repairs happen. So that is how the radiation works. and that is how the normal cell, when you are treating with radiation, recovers. So it's a process of recovery as well as the damage to the cancer cell. That's how it works. And and besides that, you have chemotherapy, which again hits the normal cell as well as the cancer cell. There also the same process where the normal cell is expected to recover, whereas the tumor cell is not expected to recover, or it takes longer time to recover. Before that, you give a second cycle of chemotherapy. That's how we hit. And besides that, the technology of radiation is, heaps and bounds. It has grown. Tremendous changes have happened because of the computer technology and artificial intelligence. We are able to treat the deepest of the deep tumor in the body with very minimal dose to the normal structures, which are very close to the tumor. So that is how we are able to generate and deliver very high doses of radiation to the target and very minimal dose to the normal structures, wherein the cure rates have increased and the side effects have decreased. Earlier, people used to get scared of going for radiation treatment. These days, the precision of radiation is so good that the side effects are almost negligible, and the radiation is able to deliver higher doses and higher cure rates are possible. So there are certain instances where we don't need surgery, we don't need chemotherapy, only with radiation, we're able to cure them completely. For example, there is a small lesion in the brain which is less than 3 centimeters. We can treat without producing a single drop of blood by doing this kind of radiation. It's called stereotactic radiation, where we completely burn up the tumor in the brain, and that is the end of it, and there's no need for surgery or chemotherapy. Similarly, you have a lesion in the lung. Earlier, we used to do surgery for a stage 1 or stage 2 lung cancer. Now, these days, we are able to treat with stereotactic radiation. You just burn them off without any smoke, without any burn to the patient, and the tumor is completely gone. So similarly, anywhere it's in the liver or in the vertebral body, anywhere we are able to deliver such type of high precision radiation therapy because of the technology that is available. And of course, we need to have some definitive experience and expertise to deliver such kind of high doses to these lesions.
Right, sir. So, though the with advancement in precision medicine, technologies like AI has transformed this cancer treatment outcomes, but still, if I'd like to ask, cancer treatment today less frightening than it used to be?
Definitely less frightening, and
Okay.
patients should never ever, earlier patient even never used to go even for investigations with the fear of getting diagnosed, with the fear of getting the treatment related toxicities and side effects. But these days I keep telling them, please do not get worried, go and get the investigations done. If you have any kind of symptoms, do not hesitate to go for symptoms, because cancer is treatable, curable, and also these days the treatment is very minimal side effects, and you'll recover. Even those side effects are temporary, and you will recover and you'll get back to normal life and normal activities once the treatment is done.
Right, sir. Sir, in continuation to this, I'd like to know what common myths about cancer would you like to dispel, and what lifestyle changes can significantly reduce cancer risk?
Right. So now there are three main things: surgery, radiation, and chemotherapy. So surgery earlier used to be removal of the entire organ. Now there is only small lump removal. Besides that, there are no damage done to the body or cosmetically, and also that functionally patient will go back. And more importantly, bloodless surgery, very minimal blood loss with when you have gone from huge surgeries to laparoscopic surgery. Now, minimal invasive surgery and robotic surgeries have reduced the hospital stay, and patients recover in a day, and the next day the patient goes home after the surgery being done. So that's an enormous difference in the outcomes, and also in the morbidity and mortality of these patients undergoing cancer surgery. Next in line is the chemotherapy. Earlier, we used to do intravenous chemotherapy. Patients used to have nausea, vomitings, hair loss. They used to become very, very sick. These days, it's only, as I told you, we analyze the tumor molecular level, understand the tumor properly, and do only precise drugs which directly act on the tumor. So we have a targeted therapy, immunotherapy besides the chemotherapy drugs. Based on that, only the treatment is delivered. And even though you have any patients side effects with these drugs, they are all minimal, and the patient would recover in no time once the treatment is delivered. Then the next is radiation treatment. Earlier, patients used to get skin burns, ulcers. Patients used to stop the treatment in between and run away from the radiation treatment. So those days of burning and charring have gone. These days we have go high precision radiation with very, very minimal side effects. Patients will not even know that the treatment is done. For example, earlier breast cancer radiation used to be 5 to 6 weeks. We are able to deliver that in 5 days. Patient doesn't even realize that the treatment is done, and the patients will walk out without any skin burns. So every part of the body that is being treated these days, we are able to deliver safely, especially in the pediatric age group. Then child cancer patients also get radiation done if required, and those children tolerate it very well.
Okay. So, which cancer are most prevalent in India today, and what preventive screening do you strongly recommend?
So prevention is better than cure. First is most important is prevention, then comes the early detection, and then to the treatment. So prevention is definitely very, very important. What all the events that we do, cancer awareness events, we focus on prevention of cancer. 70% of the cancers today are preventable, and that's based on our lifestyle changes. If you have simple thing avoiding tobacco in smoke or by chewing, and doing a proper exercise of 40 minutes to 60 minutes every day, physical, regular, organized exercise, or any kind of a sport that you get involved, that's very, very important and easy for you to do the exercise. Third is the diet. Diet is very important again. Non-spicy, non-fried food, boiled food, and not less of non-vegetarian, high of salads and fruits, greeny leafy vegetables. God has given you plenty of colored vegetables. Any seasonal vegetables, any seasonal fruits would have a lot of anti-cancer agents that protect your body from cancers. So these, if you follow these things, certainly obesity has to be avoided. Fat diet and high calorie, high protein diet is a myth. People are going into high protein diet. You need to have a balanced diet. Body needs both carbohydrates, fats, and proteins, not just the proteins. And do not avoid carbohydrate. So it should have a balanced diet. So keeping that in mind, you should focus on your health by preventing this. If you look at the incidence of cancers, the cancers that have gone significantly high, what are those cancers? Right from the oral cavity to the anal canal. That means oral cancers, throat cancers, food pipe cancer, stomach cancer, intestinal cancer, rectum cancer. What are these? These are all our exogenous substances that we eat and drink every day. So if you can protect these, if you modify your lifestyles, all this cancer incidence would come down. Coming to females, most of the women these days, unfortunately, incidence of breast cancer is going up. Why is that? It's our own reason. We are the reason, we are responsible for it. Earlier, cancer cervix was the highest incidence. Now, cancer breast is more common than the cancer cervix. Why is that? It is because of our own negligence and our low lifestyles. Westernization, no exercise right from childhood. Children doesn't even do any games. They look at the laptop, they look at the ipad, they look at the phones, and the menarche which is supposed to happen at 11 to 13 years nowadays happening around 8 to 9 years. So early menarche, late marriages, do not not feeding the baby, and trying to continue to have menstrual cycle by using hormones at the age of 50. These are the causes for increasing the incidence of breast cancer. So marriage at 23, 25, right age, having a first child birth before 30 years, and feeding your baby will protect you from breast cancer development.
Right, sir. Sir, how can rural or underserved population gain better access to cancer care?
Nowadays, every decentralization. People from Hyderabad used to go to Delhi. Now nobody goes to Hyderabad, from Hyderabad to Delhi or Bombay. So we have centers in Hyderabad. We have peripheral districts headquarters. We have all the cancer centers, and they are accessible to do cancer screening programs in the villages and towns. So, but people should come forward and get this screening. And even in the urban population, we encourage people to do cancer screening. Compared to the European and United States population, our population, we have cancer incidence happening at a lower age group. So we should start screening right from the age of 35. So, and the vaccination is very important in the rural population, because the cancer of the cervix is more common in the rural population, and we are trying to do the government of India has promised us to give vaccine. We have provided a vaccine, which again has to come into enforce. And if you do the vaccination, the cancer cervix can be prevented by 99%. So that vaccination has to go to the rural areas, and that we are doing in orphanages and we are doing in the rural population from our foundation. But besides that, entire country need to get this vaccination done, which has to get enforced, which is announced by central government but not enforced yet. That will protect the rural population from the cervical cancer, and avoiding the tobacco chewing and BDs and cigarettes in the rural area. That will prevent majority, 35 to 40% of the cancers are because of these BDs and chewing of tobacco and pan masalas and all kinds of stuff. So that can should be implemented quite seriously, and promotional activities. The media, the press have to every day in the newspapers have to have one part of the column, especially the corners of the newspaper should have the awareness, because now the most common disease in the world is cancer. Unfortunately, it's no more the cardiac or accidents or infection. Cancer incidence is alarmingly going high and high. So we every citizen have to feel the responsibility and create some kind of awareness. And that awareness by media, by TV and press is the most important, is what I feel.
Right, sir. Sir, talking about your personal this thing, how do you balance aggressive treatment with quality of life for patients?
There always that's a clinician's judgment. Quality of life is very, very important. In an early stage disease, we have to be aggressive, little bit of compromise on the initial side effects of the treatment, because in stage one and stage two, you need only one modality of treatment. It doesn't require three modalities of treatment. For example, it could be only surgery, it could be only radiation. So that kind of a treatment will not cause much of a morbidity. The issue comes only if the patient comes in stage 3 and stage 4, where you have to balance between the cost versus benefits and the quality of life versus longevity of life. So these are very important when you are deciding on the mode of treatment. That is very important on the financial, social aspects of the patient, psychological aspects of the patient. You are extending life by 6 months, but the patient is lying down on the couch for all 6 months, does not make any sense. So you need to look at the quality of life is very, very important when you're looking at the quantity of life, especially in a stage 4 disease. You need to look at multiple factors: financial, social, quality of life, and the quantity of life.
Right. So receiving the Padma Shri is a prestigious honor. So what did this recognition mean to you, and how do you stay motivated while dealing with critical and life-threatening cases?
When I started my career, I never, try to do things to get an award or being recognized. But I'm so happy that it has been recognized for our quality work, the service to the society, the cancer awareness events that I did, more than 60, 70 awareness events, and the educational programs to create awareness among the young oncologists in the country and in the world. So that's that for being recognized. I'm so happy, and of course at the same time I'm humbled, and I feel honored and humbled. So that actually is, of course, is a dream come true. But at the same time I feel regenerated, reactivated, and I feel that I should feeling more responsible to do more and more things to the society. Some innovative things that I need to do, create more and more awareness in the society, so that actually this Padma Shri has definitely making me think more and more to do more and more to the society.
Right, sir. And in the end, I like to know, do you believe cancer will become a manageable chronic disease in the near future? What is your vision for the future of cancer care in India? And what improvements are still needed in India's cancer care ecosystem?
Right. So when I started my career 30 years back, the cancer incidence was much lower and the cure rates were hardly 30-40%. Now we are able to cure 70% of the diseases, whatever we see today, across all stages. So that's a gratifying thing that we keep telling people, that cancer is highly curable. So don't be scared of cancer, but be scared of late diagnosis.
True.
So being conscious, this is going to be one in third house you're going to develop cancer. every other person, irrespective of the caste, creed, and the socioeconomic status, everybody is prone to develop cancer. So be aware of it. Don't be scared of it, but be aware of it. If you have any kind of symptoms, come forward and get it diagnosed and get it treated. So that's what I keep telling when I talk to people and when I have speeches, when I talk to the society. Besides that, my advice to the people is that don't run away from cancer. So it is highly curable. Less toxic treatments have come. Besides that, you'll go back to society. It is not like a diabetes or asthma or hypertension or a cardiac disease where you have to be a patient lifelong. Whereas cancer treatment is only a short course of treatment. In a stage 1 and stage 2, it's only a 2 weeks, 3 weeks, and after that, you don't need to come to the doctor. For a stage 3 and stage 4, even then, we treat the patient for 4 to 6 months. And after that, you are out and you are going to go on your own. So, unlike the other diseases, cancer is not a chronic disease. It is a treatable disease, curable disease. Once it is done, it is done. We are only asked to come every 3 months or every 6 months or every year for the first 5 years. And after that, you don't need to go and meet the doctor again. So that is what you need to understand. It is much better disease. We can much defined disease with much more depth into the subject we got into, and we know how the tumor is going to behave and what are the drugs that can be given to control this disease or cure the disease. So we are much aware, much wiser, and we have a better knowledge, better understanding of the disease, and we are able to cure them. And the future is going to be much better. Crores and millions of dollars are into research of cancer, and we are getting newer and newer molecules. We have so many weapons these days to use for to treat or to control the disease. And in the near future, you're going to get more and more. And cancer is going to be a disease which is going to be eradicated.
Right, sir. Thank you, sir. So well said. Awareness, early diagnosis, don't fear or run away as it's a curable disease. Thank you, sir, for this insightful conversation and for your thoughts. And thank you once again.
Pleasure is mine. Thank you.